Thank you, Emily, and thank you, ladies, for being here, and thank you all for joining us. Aren't those fabulous statistics? 83% now of children who are diagnosed with cancer survive to adulthood. I'm curious, how many of you in the audience know a childhood cancer survivor? Wonderful. I would say that's at least maybe 60% of the audience. So exciting, so exciting. Congresswoman, I'd like to start with you. You are so passionate on this issue, and you're one of the real leaders, the policy leaders in Congress. How do you think we're doing on this issue today? And also, I wonder, what do you think about what the president proposed in his State of the Union address, an additional $500 million over 10 years for pediatric cancer?
So, first of all, this is a great example that you should repeat over and over again to your friends and family when there's this action about dysfunction here in Congress. This is where Republicans and Democrats, Mike McFaul and I, work together to make sure that we would provide a bill that would have the support of the president. And I was very proud when he signed it into law. I think we have to give Vice President Mike Pence some credit, who appears to have a great passion on this issue and brought many of the scientists and experts together in early March to talk about this issue as well. So my passion comes from the fact that I saw just such a great injustice with children because they don't have loud voices, were receiving so little of the money in cancer research.
And it was, what did I hear? The statistic at one point was 4% of the National Cancer Institute's budget.
And I think that what happened was there was, such excitement about the fact that, well, these children are now living longer, that was good enough, except it's not good enough. And what we have found is that it's the secondary cancers and the complicating illnesses that come after they have survived their initial cancer that is of great concern to all of us.
What about what the president proposed? So $500 million breaks down to $50 million a year. That will help, correct?
It certainly does. Unfortunately, he also wants to cut the National Cancer Institute budget by $900 million.
15%, right?
Yeah, the good news is that just last week in the Appropriations Subcommittee, Rosa DeLauro added back $300 million. And I heard from Dr. Lowy, who is the acting director of NCI, that he's had a conversation with Senator Moran, and there is an interest to increase the NIH funding to an additional $2 billion. So those are all good news numbers because they all interrelate with each other. If you don't have NIH robustly funded, NCI is going to be impacted by it as well. But the good news from this grant program is that there's about 15 grant applications that have been received and are now being reviewed through the peer review process. And in short order, we should have grant monies going out to pediatric cancer researchers to look at the kinds of interventions we need to help these children be able to survive successfully, not get secondary cancers or complicating diseases, and find less toxic treatments to be used.
Keysha, I wanted to bring you in what does your organization think about what the president has proposed? Is that going to be a big help? Because I saw the reports, and then some people came immediately and said, well, but when you look at what President Obama proposed in 2016, the cancer moonshot, that was $500 million a year. And then George W. Bush, when he was taking on global AIDS, that was $3 billion a year. So $50 million rather pales by comparison.
So the American Cancer Society Cancer Action Network appreciated the nod that the president made to the issue and importance of childhood cancer funding in the State of the Union. The fact that the increase at $50 million is not enough from our perspective. We think that, of course, there needs to be more, but it's a good first start. And you have to start somewhere, and we we will continue, of course, to make sure that we're making the case that increased funding for childhood cancer research in this current fiscal year budget is higher than that. I think that it is an opportunity for us to talk to the administration about how they think those dollars should be used. Our understanding is that they want to look at using some of that additional funding for data and looking at how data can be used, specifically at looking at childhood cancers across the country.
Well, I've heard some say that they feel like, well, that data issue is already being handled relatively well with pediatric cancer. Maybe the funding should go elsewhere.
So I think from our perspective, there's always a need for more data. One of the things that we always look at for childhood cancer is making sure that we aren't treating children as little adults and making sure that we are looking specifically at that population and how they need to be served better. But for the larger funding, from our perspective, we will advocate for additional funding. As the Congresswoman said, going through the annual appropriations process, our ask is for increased budget for the National Institutes of Health as well as the NCI budget.
I think we've got a new mic for you here. We're having a little interference. Congresswoman, you touched on in your answer earlier the STAR Act. So that was passed. I believe at least the House voted on it unanimously the day of this very event last year, which was really exciting. How is that going? I mean, you mentioned some of the things, some of the strides that have already been made. What else is going on with it?
So the interest now is to look at new treatments, and these grants are going to be the first step. That's going to be one of a series of grants that's going to be offered up. Secondly, there's an emphasis on what are called biospecimens. So increasing the quality and the number of biospecimens that will be used in research. So Dr. Lowy, who, by the way, really regrets not being able to be here today, he is receiving an honorary degree from New York University, so we can give him that pass, I think.
Congratulations to him.
And, he is feeling pretty bullish about the focus on pediatric cancer now. He's been at the NCI since early 2010 in the deputy position and now as acting director. And I think finally we have traction on the issue of childhood cancers that frankly we didn't have before. And I've got to give all the credit to the families and the young children survivors who are so incredibly powerful when they come to Congress and lobby, because you can't say no to them. And Mike McCall has done, a remarkable job building the whole family organization over a long period of time. He and his wife have done a great job in that regard.
Keysha, before we go to the audience for questions, I wanted to ask, when it comes to funding for cancers, I guess the lion's share of it comes from the federal government. How do you, especially your organization, how do you keep from pitting one type of cancer against the next when they're all so very deserving? But again, without the federal funding, so much research goes nowhere. I've heard the statistic of 4 potential cancer projects. Out of 4, only 1 is funded, and the rest basically die on the vine.
Yes, the continued investment in federal research funding is a priority, and it's something that our advocates are able to take that voice up to Capitol Hill every year when they are in town, and making sure that their legislators know how important it is to make sure that continued investment moves forward. And from our perspective, we actually advocate for the overall budget of the National Institutes of Health and for the overall budget for the National Cancer Institute. And we don't pit one against the other, because as the American Cancer Society, Cancer Action Network, which is the advocacy arm of the American Cancer Society, we represent millions of cancer patients across the country. And we know the researchers at the National Institutes of Health will be able to really look at what are those priority programs and research priorities that need to be funded. And from our perspective, though, really making sure that continued investment is key.
All right, let's go to the audience for questions. And if you would identify yourself, and if you don't have a question, oh, here we go. We have one here in the front.
Hi, Danielle Leach, St. Baldrick's Foundation and the Alliance for Childhood Cancer. Can you talk a little bit about, there's the 50 million for the President's Initiative, and then there's 30 million for the next 5 years, every year for the STAR Act. Can you talk a little bit, and I think either Keysha or Representative Speier can talk about this. You know, when we talk about prioritization, sometimes those opportunities come along based on that to ask for more. And how do you envision pushing forward to ensure that it's not one or the other, it's more?
Excellent question.
Well, I think I would kind of throw the ball back at you because we expect all of you to come back to us and say, you know, nice try for first time out, but we need so much more. I think that what we are realizing now is that as much as we know about childhood cancers, there's so much we don't know. And it's really important for us to redouble our efforts in that regard. DIPG is a good example of a cancer that is the second most common cancer. The survival rate is abysmal, and we need to spend much more time and energy and resources into finding out what will work for that particular type of cancer.
And I would just add that the STAR Act is really important. The funding, it's a legislation that we're very involved in helping to pass, and making sure that specifically the survivorship research that's included in the STAR Act is really important, especially since a number of childhood cancer survivors these days now, their life expectancy is so much longer than it used to be because of the amazing therapies that people are now able to take. And so making sure that they are having the care that they need throughout their continuum of their life is really important, and that STAR Act funding will do just that.
All right, another question. We have one in the back here.
So Michael Saugeller from National Cancer Institute. Could you just comment, especially ACS, on the importance of having some of the money allocated to help train the next or current generation of potential pediatric cancer researchers, because in their training they usually receive much more exposure in the oncology space to adult cancers rather than looking at the opportunities in pediatric research?
Excellent, more directed training. Okay.
Yes. So I would say that our organization believes that making sure pediatric cancer researchers are funded and their research is funded is definitely a priority. The American Cancer Society is one of the highest funders of cancer research next to the federal government, and pediatric cancer is an area that we are actually investing in as well. We have an amazing new initiative with St. Baldrick's as well, where we're trying to raise more funding for pediatric cancer research. So it's definitely a priority that we're very much focused on.
You know, I would also add, and you probably know this, Dr. Lowy indicated to me that you're going to see at NCI a doubling of the scientific researchers for pediatric cancer. So that's a really good sign.
That's as a result of the STAR Act?
Right.
Fabulous, really exciting. More questions? One again here in the front.
Hello, my name is Ellen Miller. I'm with the Smashing Walnuts Foundation, and my daughter was Gabriella Miller of the Gabriella Miller Kids First Research Act. Question for you both, your opinions on the fact that there are only 4 drugs that were specifically for childhood cancers. Your thoughts about that, and what is it that you all can help us in the childhood cancer world to make a difference, to find drugs specifically for children, not drugs that were adult drugs that trickle down to kids?
How do we get pharmaceutical companies to make that investment when childhood cancer is just 1% of all the cancers in the U.S. that are diagnosed every year?
You know, that's a very tough question to answer because, you know, the venture capital money goes where there's the highest bang for the buck. And there's an investment being made. They want to maximize what they see in returns. We do have a role, though, and I think that earmarking specific funds for the development of drugs specifically for children would be one of the things we can do. You know, it's interesting to note just generally, most pharmaceutical drugs, when they were tested in clinical trials, for the longest time, were only tested on men. And I actually carried legislation when I was in the state legislature that basically provided that if you were going to test drugs in California, you had to make sure that the universe was representative of the population of the state. And so the pharmaceutical companies came to me and said, "You just don't understand, Jackie." I said, "What don't I understand?" "Well, the reason why we don't use women in clinical trials is because they're premenstrual, postmenopausal, or of childbearing age." And I said, "Oh, okay. So then I'll just amend this bill and require you to put a label on every prescription that is filled and indicate whether or not it's been tested on women." So this goes way back in time because, by the way, the bill did get passed and did get signed into law. But it has a lot to do with who's at the table and who's making the decisions. And in the case of many of these products, they were virtually all men. So the more we have women at the table, the more the voices of parents and children with pediatric cancer speak up. And the more we in Congress can recognize that we need to give an extra boost for pediatric cancer research and drugs, the better.
Ladies, thank you so much. Congressman Speier, Keysha, you're wonderful. And thank you for your terrific questions.